Welcome to Maternal Fetal Medicine. Whether it is your first time with us or we've seen you in a prior pregnancy, we look forward to being part of your care team. We are an outpatient clinic that provides high-risk obstetric consultation to patients and providers on the South Shore. Our staff includes support staff, sonographers, nurses, counselors, and perinatologists, who are OBGYNs with specialized training in high-risk pregnancies. Many patients who are not high risk also receive care in our unit. This short presentation will help you arrive at your first trimester visit fully informed. Before your visit, you will speak with a counselor, either by phone or video call. This session will help prepare you for your visit and answer your questions. You will be asked to choose the type of blood screening you prefer, if any. Additionally, we will review your medical and family history. Before we proceed with the details of the visit and testing options, we will briefly explain common chromosome conditions. These are karyotypes, or pictures of chromosomes. Chromosomes contain your genetic information, or DNA. There are 23 pairs of chromosomes. One chromosome from each pair is from your biological mother, and the other from your biological father. A male has an X and a Y chromosome, and a female has two X chromosomes. The condition most people are familiar with is Down syndrome, where there is an extra copy of chromosome 21. When there are 3 chromosomes instead of the usual 2, the condition is called a trisomy, meaning 3, like triangle or trimester. Down syndrome is also known as trisomy 21. Children with Down syndrome have some degree of intellectual disability, are more likely to have certain health conditions, but most often live into adulthood. Trisomies can occur with any chromosome. For example, trisomy 13 and trisomy 18. Trisomy 13 occurs when there is an extra copy of chromosome 13, and trisomy 18 when there is an extra copy of chromosome 18. These conditions are among the most serious and are considered life-limiting. The sex chromosomes, usually either XX female or XY male, may also have an extra or missing chromosome. Disorders of the sex chromosomes are generally not as severe, but may have associated medical, behavioral, and learning issues. Even very small pieces of missing or duplicated chromosome material can impact fetal development. These are called microdeletions or microduplications. These conditions are uncommon, affecting 1 in 270 babies, or less than 0.5%, but are usually significant when they occur. Chromosome abnormalities do not typically run in families and most often occur out of the blue. Now that you have an understanding of chromosomes, let's focus on the details of your upcoming screening visit. The visit begins with an ultrasound. We ask that you fill your bladder by drinking approximately 24 ounces of fluid during the hour before your appointment. Because this ultrasound is performed on your belly, a full bladder allows the sonographer to obtain optimal pictures of your baby. She will document the fetal heart rate, measure the length of the baby, and look at some of the early structures of the baby's anatomy, including the profile and the nasal bone. In addition, she will measure a pocket of fluid behind the baby's neck, called the nuchal translucency. This is the NT measurement. Obtaining all of this information depends on many factors, including the baby's cooperation. Sometimes, due to a baby's position or sleep cycle, not all of the information can be obtained. If this occurs, a provider will chat with you about the next steps. The sonographer is more than happy to guide you through the exam, and you will be provided with pictures. Once the ultrasound is complete, your images will be reviewed by a physician, and you will learn the results of the ultrasound before leaving our department. The second part of screening is an optional blood test. Blood testing in combination with ultrasound increases the detection rate for chromosome conditions. There are 2 different blood tests to choose from: early risk assessment, or cell-free DNA, also called non-invasive prenatal testing, or NIPT. These tests only require 1 tube of blood. Early risk assessment involves taking a small sample of the woman's blood, measuring hormones only present during pregnancy, and estimating the chance for a pregnancy to be affected with Down syndrome, trisomy 13, and trisomy 18. This screening test has a detection rate between 93 to 95% for these three conditions. The false positive rate is about 2%. That means that 1 out of 50 times we do the test, the results indicate an increased chance, when in fact, the baby may not be affected. Results of this test take approximately 3 to 5 days. All normal results are sent directly to your OB provider's office. If your result shows an increased chance, a counselor will contact you to explain the results and discuss your options. Cell-free DNA, or NIPT, is also a simple blood test from the mother's arm. During pregnancy, small fragments of DNA are shed from the placenta into the mother's bloodstream. Because the baby and the placenta develop at the same time, most often the placenta's DNA reflects the baby's DNA. The false positive rate of cell-free DNA is less than 1 in 300. Results for cell-free DNA testing take approximately 7 to 10 days once the sample is received in the lab. These are the 17 conditions on the cell-free DNA panel. Trisomy 21, 13, and 18 have the highest degree of detection. Trisomy 16 and 22 are much more rare and are associated with pregnancy loss. The areas marked with small red boxes represent specific microdeletion syndromes. These are quite rare, and detection rates for these conditions vary. The test also looks at sex chromosomes to screen for sex chromosome variants. You can find out the baby's sex if that is information you'd like to know. If not, we simply ask the lab to withhold that information. However, if there is an abnormality involving the sex chromosomes, the X or the Y, the counselor may need to reveal the baby's sex in order to help fully explain the condition. In addition to the information already presented regarding cell-free DNA, or NIPT, it is important to mention that if a patient has her 18 to 20 week ultrasound and there is an ultrasound finding, very often the level of concern regarding the finding is extremely low if the patient had NIPT and the results are normal. Here is a direct comparison of the two different blood tests. During your session, let the counselor know if you're interested in blood screening, and if so, which blood test you prefer. All screening and testing is optional. Results will return as either negative or positive. A negative result significantly reduces the chance that the pregnancy is affected with one of the conditions on the panel. All negative results will be emailed or called to you. A positive result indicates the chance is increased. A positive result does not mean that your baby is affected. If you have a positive result, a counselor will contact you to discuss further testing options. Most insurance companies cover both ERA and cell-free DNA screening for all pregnant women. We partner with a lab that provides prior authorization from the insurance companies and offers a program that limits the cost of cell-free DNA to $299. Your out-of-pocket expense for either test will range from $0 to $299. Some people prefer the most comprehensive testing available, which is a diagnostic test. Diagnostic testing is different from screening. There are two common prenatal diagnostic tests: chorionic villus sampling, CVS, and amniocentesis. CVS involves taking a small sample of the placenta between 11 to 13 weeks gestation. Amniocentesis involves taking a small sample of amniotic fluid from around the baby any time after 15 weeks of pregnancy. Although diagnostic tests provide the most comprehensive information about a baby's chromosomes, these tests carry a small risk of loss to the pregnancy. Both of these tests can provide detailed information about all 23 pairs of chromosomes, beyond the detail provided by blood screening. Should you wish to know more about either test, your counselor is available to answer your questions prior to your visit. Please remember, most women will have a normal outcome to their pregnancy. Screening tests allow you to obtain additional information about the baby during pregnancy. Most chromosome abnormalities do not run in families. All screening tests are optional. All pregnant women may choose screening or diagnostic tests regardless of their age or family history. Here are some excellent resources if you want to learn more about some of the conditions mentioned. Our goal is to help you learn about your testing and screening options and to support you through this process. It is our privilege to care for you in maternal fetal medicine.